Gender disparities persist in diagnosis and procedures of acute myocardial infarction. Key takeaways: in hospital mortality after CABG or PCI remains higher for women in many cases. Despite recent advances, gender disparities still exist in diagnostic evaluation and revascularization procedures for patients with and without STEMI, according to data the Journal of the American Heart Association. The improvement gender trends in diagnostic evaluation and revascularization STEMI is reassuring. However, similar trends were not seen for those without STEMI. Therefore, sustained national quality improvement initiatives are needed. These patients, wrote Dr. Muddasir Ashraf, a postdoctoral research fellow at Aurora St. Medical Center Milwaukee, and colleagues. Adobe Stock In, a study of 9,259,932 patients with acute using National Inpatient Sample data from 2005 to 2019, researchers evaluated gender trends over 5 3-year periods. 42% of patients without STEMI were female and 32% of those with STEMI were female. For patients without STEMI, the investigators found a small reduction in gender disparity in the use of all diagnostic angiograms for period 5 versus period 1. However, there was no change disparity in PCI use and an even wider disparity CABG use. Also, in patients without STEMI, risk-adjusted in-hospital mortality after CABG was higher for women than for men. For patients with STEMI, investigators found a reduction in gender disparity in the use of diagnostic angiography, PCI, and CABG. Risk-adjusted in-hospital mortality in STEMI patients was higher in women after PCI and CABG compared with men. We saw much more significant improvement gender disparities in all diagnostic angiograms, PCIs, and CABG rates STEMI patients, Ashraf and colleagues wrote. Despite these trends, there are still disparities in the use of these procedures for both non-STEMI patients and patients with STEMI.